Hi, Nathan Stickney here at Foot and Ankle Associates of North Texas. I'm going to talk to you about a very common condition, foot and ankle fractures. Now, one of the most common injuries to the foot or the ankle is a fracture of either the ankle joint or of the fifth metatarsal or any metatarsal in the foot. These fractures are very, very common. Any kind of traumatic event can cause these fractures. These fractures can be very debilitating if they're not appropriately taken care of. What will happen is if you have an injury to the foot, you'll come in and we'll take an x-ray of the foot and the ankle. The x-ray will show us if the bone is fractured. Generally, depending on the fracture can be displaced, which means the two edges of the fracture shift and are not appropriately lined up, or a fracture can be non-displaced, which means the fracture has completely through the bone, but it still lines up in a good position. This matters because this usually depends on what treatment option needs to be done. If you have a fracture that is non-displaced, generally what we can do is immobilize the area or put you in a cast and keep the weight off of it. The bone will naturally heal itself up, and considering the bone is still in good position, then the bone heals in that good position. Treatment option for a non-displaced fracture is usually a surgical treatment. A non-displaced fracture generally will affect the joint. By affecting the joint and by the fracture not being lined up, you can get very traumatic arthritis in the future, which can be very debilitating and be very painful. So on a displaced fracture, generally surgical treatment is the treatment of choice. What we will do is we will go back in, line the fracture back up, get it nice and reduced, and then with either screws or a plate, we will fixate that fracture nice and straight. What this will do is this will realign the joint, and it'll take a lot of the pressure off all the joints in the area. Generally, with a displaced fracture, you'll be in a cast for about 4 to 6 weeks after surgery with no weight bearing on the cast. If you have any of these symptoms, then please give us a call at Foot and Ankle Associates of North Texas, and we can take care of your foot or ankle fracture.